The female brain is lighter than the male. According to Manouvrier, the weight ratio of the female to male brain is 89 to 100. Some have argued that this difference, along with differences in the weight of the skull, stems from women being relatively smaller and lighter than men by 11.5%. However, if we discount this consideration, we will see that the weight of the female brain is still lower, although in this case, the differences are not as obvious. A noble-thinking, rational woman will never consider it to be something inappropriate if, as a housewife, wife, and mother, looking after not only the moral but also the material good and the health of her loved ones, she caringly takes the helm of the household in her hands and does not use noisy words. There is dedication when she gets her hands dirty in the kitchen. So what can be humiliating in the way that the lady of the house, wife, and mother knows exactly what to put in the saucepan so that a dish is healthy and tasty? On the contrary, I am sure that the knowledge of all these details, starting from the art of cooking, based on general, careful, and even refined education, raises the woman in the eyes of every reasonable man. From the excessive burden of housework, from constantly being troubled by conflicting details, sometimes a distaste may arise, a wearing down of health and happy thoughts, an emotional imbalance. There are housewives who ceaselessly do everything with their own hands. In this way, the servants never learn responsibility for their own labors. By no means is it the duty of the housewife herself to go to market with the cook and to make her own purchases. The servant who cleans the room, does the wash, lays the table, let her do her job. And when she has finished, one must go and see how it is done. We counsel you to write out tables for the servants and hang them in the kitchen. And on the tables, the whole order of the day should be set out, from morning to evening. And on another table, there should be laid out the work for the whole month. This is the recommendation for the junior maid. Before 6 in the morning, rise, dress, order the dining room, set the table, and prepare breakfast for 7:30. Immediately after breakfast, wash the dishes and clean the rooms. Lay the table for dinner at 1:30. Wash up, make coffee, and lay the table for tea at 4. Wash up, prepare supper, and serve it at 7:30. Wash up, turn down the beds, and go to sleep at 10:30. Among these duties are other tasks, such as laundry twice a month, a smaller and a greater one, the washing of windows 4 times a month, and a great cleaning every 2 weeks. Nursing a child from one's own breast is, indeed, a heavy task, compelling the mother to renounce many customary occupations and to wean herself from the pleasures of company. But the child's unceasing needs, the bothers, the difficulties, and sleepless nights, these form a woman, perfect her, raise her in her own eyes, in those of her life's companion, and of all who surround her. And after all, they do pass. Only specific nervous states connected with nervous attacks free the mother from nursing her child. Common nervous states, which are a rather nervous irritability, cannot constitute a reason for discontinuing to nurse. Quite the opposite. Irritable persons, once they have taken on the duties of motherhood, often find in their fulfillment a healing for the nerves. Portly wet nurses with slack breasts lose their milk with ease. Better are slender wet nurses who have firm breasts. The wet nurse should have a fresh and ruddy complexion, happy eyes, clean and unreddened eyelids, red and unchapped lips, healthy white teeth, red gums, breath free from odor, breasts of a modest size that are round and firm, blue and extended veins, well-formed breasts without eruptions and incrustations, a moderate quantity of fat, a smooth and clean skin, devoid of pimples, stains, and rashes, and lastly, she should not be inclined to excessively odorous sweating. On pressure, the nipples of the breast should give out milk in thin streams from many milky ducts and generously. But all that does not provide a guarantee of the wet nurse's excellence. Finally, we may judge that when we have seen her child. For if it be merry, well-nourished, of regular digestion, clean skin, and sleeps quietly, then this is the wet nurse's best recommendation. Let the wet nurse fetch wood and draw water. Let her wash the child's small clothes and perform other services. For idleness and lack of sufficient movement leads to a thickening of the milk and ruination of the infant's health. The common faults of wet nurses, an escalation of demands, fractiousness, the need to supervise each step, these demand on the mother's part much patience and facility in making concessions. Alas, among us the need for wet nurses grows more and more. From this does not a social harm arise? The child is given to another woman to nurse. Frequently further, the wet nurse's own child receives only artificial nourishment and is, as they say, placed by the jug. Naturally, the majority of a wet nurse's children die. When a wet nurse's child dies, she suffers through her loss and slowly heals her hurt, drawing nearer, it may be, to the second milk child whom she feeds.